Thank you. And I would first turn to Elder Bill Cramner to say those words that go before all others. So turn to you, Elder Cramner.
So am I on?
Yes.
Can you hear me?
Yes.
Okay. I'd like to start, of course, by saying thank you to the Squamish, Musqueam, Tsleil-Waututh for us doing our important work on their land. I'll do a prayer song to ask our Creator to be with us, guide us in our work that we're doing for all the First Nation British Columbia. Again, I call on our Creator to be with us, guide us in our work. Point of interest, I'll be heading over to our health center to get my second vaccination shot at just after lunch. Thank you.
Thank you for starting our regular media event in a good way. I'd like to start by saying that the announcement on global TV this morning that there was some sort of media announcement is not completely accurate. As many of you may know, what our practice has been is to have regular media opportunities so that we can efficiently provide access to media, yet have our medical practitioners still able to do the job that needs to be done. So I just want to clarify that at the outset, and I see that we have a number of First Nations representatives on the call. Usually this is a media call, so we will be answering the questions from media. We have other opportunities for questions for First Nations leaders and representatives. So with that, I just want to start by saying that there has been really considerable activity over the last period since our last call, and that our team is here really with considerable depth to be able to go over some of this. Our intention will be to have very brief updates as sort of a backdrop, and then we will quickly go to questions as a way to maximize the time together. So I'd first turn to Dr. Shannon Mcdonald, our Acting Chief Medical Officer, for her comments.
You're on mute, Shannon.
I'm going to start putting a penny jar beside me for every time I do that. Thank you all. I'm calling in today from Sayut First Nation on Vancouver Island, where I am honored to live as a guest. It has indeed been a very busy time over the last month. just after the holidays in early January, we saw a significant spike in active cases. We were up over 1,000 active cases at the time. And sadly, we have suffered many losses in that period of time, some of whom, of course, became ill before the holiday season, but quite a few who had become ill afterwards. Right now, we have 426 as of Friday. I don't have today's numbers yet. They just showed up on my email. 426 active cases, and 185 of those are on reserve. So we have seen the numbers steadily climbing. We have seen many communities expressing real concern about the variants that have shown up in Manitoba and other places. So far, we have not seen that among our the cases in our communities or in our urban populations. We still have some communities that have had significant clusters. Many of them are resolving, but it takes time. And we have been busily working with our communities to follow public health recommendations in the best way they possibly can. We saw the result of the gatherings that occurred over the holiday season with that big spike, and that has certainly come down significantly. And I really want to thank our communities for taking that in hand and moving forward with what needs to be done. I will leave the details of the vaccine implementation to my colleagues and partners, but needless to say, in the context of vaccine shortage, we have not been able to completely meet the goals that we have set, but we have used every single dose that we have been given to vaccinate as many people as possible, starting with our most remote communities and moving inward, recognizing communities that have had significant clusters. And we will continue to do that and have received strong commitments from the provincial government that when vaccine is available, it will be given to us to do what we need to do. So thank you, and I will pass it back to Richard.
Thank you. So I'd like to next turn to our Chief Nursing Officer, Dr. Becky Palmer.
Hi, good morning all. My name is Becky Palmer, Chief Nursing Officer with Fnha, and I'm calling in today from the traditional territories of the Katzie, Kwantlen, and Semiahmoo First Nations, where I'm a guest on these lands. Happy to be here. Just picking up on what my colleague, Dr. Shannon Mcdonald said, a tremendous amount of work has been done in partnership with our community leaders, in partnership with our clinicians in the field, and with our community partners as well, with a successful vaccine rollout. So we've learned many things since the vaccines first landed in our territories at the end of December. And with that, I've had tremendous opportunity to again work alongside our communities to partner to roll out a very intentional, strength-based, culturally safe, whole community approach to ensure that our people get the vaccine that they need, should they choose to take it. A tremendous amount of behind the scenes work has also been done from a nursing perspective to ensure that our clinicians at point of care are ready to go with the vaccines, that all of the safety, integrity, and rigor around that is in place. So we've got the highest standards in place, quality assurance in place around that, ensuring that we have what we need in place to do a very smooth, seamless vaccine rollout. And again, leveraging the strengths that we've always had in our communities, building on vaccine confidence, building on the strength of engagement with our community partners, and really importantly, to ensure that our engagement is happening upstream, that we're partnering with communities, answering the questions that folks may have ahead of time, and really wanting to promote deep understanding of both the vaccines, the vaccine rollout, and what we can do to partner to ensure that there is vaccine confidence alongside our communities. I think I'll pause there. I look forward to the questions. Thank you.
Thank you. I'll now turn to Katie Hughes, our VP of Public Health Response Team. Katie?
Thanks, Richard, and good morning, everyone. Just building on the comments from Dr. Palmer and Dr. Mcdonald, I just want to share that as of this morning, we just wanted to share that we've vaccinated just shy of 16,000 people in First Nations communities so far. So just over 90 communities have received vaccine to date, and we have allocations that are en route to another dozen or so communities as well. So that includes some mostly first doses, but some second doses as well. And we continue to work, as Dr. Mcdonald referenced, with our provincial partners to ensure that all 203 communities have access to vaccine as soon as possible. Thank you.
Thank you. And I'll turn to Dr. Nell Wyman for comment.
Thank you, Richard. Bujuani, I'm happy to join you this morning from the unceded territory of the Coast Salish people, the Musqueam, the Squamish, and the Tsleil-Waututh. And I think just to add to what my colleagues have already mentioned is, I am a psychiatrist by training, working now in public health. And I just would like, I think, to highlight from the point of view at Fnha that we are also in the midst of this vaccine rollout, paying attention to the mental health and wellness aspects of this. We have been living under a great deal of uncertainty and unpredictability since the pandemic first emerged about a year ago. And that's a pretty sustained period of time to exist under that amount of stress. And in certain ways, the vaccine rollout has created a new set of stresses around. We've had discussions at previous availabilities around vaccine hesitancy and the reasons why that might be the case. But as you've heard this morning from our elder, he's off to get his second dose and setting a great example for people in his community. And then on the other hand, there's a great deal of apprehension from other people about, when is it going to be my turn to be vaccinated? So we're trying to deal with those aspects of the pandemic as well. And recognizing, I've heard a lot of people talk about COVID fatigue. And, it's really a difficult ask to say to people, despite the vaccine rolling out, we need to maintain those public health measures that we've been talking about from the beginning. Wearing a mask, being physically distant, staying within our immediate household bubbles for now, washing your hands regularly. That sounds like old, tired recommendations, but that is an additional piece. That is the piece as well as the vaccine that will get us through this. So recognizing people's efforts in communities to keep themselves safe. And the last thing I'll end with before handing back is to acknowledge the losses that we have had in communities, the deaths of people due to COVID, both older and younger. We grieve for those families and their communities, and our hearts go out to them. And we all, I think on this team, are very committed to doing the very best we can with regards to the vaccine rollout and as well our pandemic response. So Miigwech, and I'll pass it back to Richard.
Yeah, thank you. I just want to acknowledge that we have our Director of Corporate Services who handles logistics, Chuck Wilmink, on the call as well, Sonia Isaac-Mann. So our team is available to answer questions and to acknowledge that vaccine availability and the supply logistics obviously have an effect and an impact on First Nations vaccines rollout, but we are involved with daily calls on multiple levels to make sure that we know what's coming, at least as far as is known, and that our overall commitment going forward is really one of transparency and being able to relay information as it becomes available. So with that, I'd like to turn it over to our media person, Kevin Boothroyd, to handle the press questions, which we are now ready for.
Good morning to all. So let's start with our first question. Are we ready there, Tim?
I'm not seeing any hands. Just a reminder to all media outlets attending, if you'd like to raise your virtual hand for a question, just click the participants button at the bottom of your screen, and then you'll see a new window appear where you can raise your hand. There we go.
That was easy. Trying to figure out where they are here. Yes, Susan De Silva, you have a question, and you are with which outlet, Susanna?
I'm with CBC. Apologies, sorry, I didn't type it in as I joined. It just relates to the variants and in terms of whether all positive cases among First Nations are being screened to see whether or not they are variants.
Thanks. It's the materials that go into BC CDC or other provincial systems for confirmatory testing. There is a system in place provincially to do the genomic testing. We now have a screening tool for those tests. So we don't do it at our level, even at our point of care testing. It needs to go up one more level. But at this point, we have not had a confirmed test that is positive for any of the variants.
Do you know though if all of the cases that are coming from First Nations are sort of being put aside and being checked for variants? Or because I know until now they did that point the one day or a few days where they checked all positive cases, but other than that, they say they generally do sort of targeted and some random screening. Do you know if cases coming from First Nations are sort of being put in a separate section and checked all of them for being variants potentially?
I don't know the answer to that. That would have to go to the provincial lab.
Katie DeRosa, I believe that you are from the Times Colonist, if I'm correct, although it's not stated there. Are you on mute?
I can see that Katie has unmuted herself, but we can't hear her. It might be beneficial to leave the meeting and come back in, Katie.
So let us try again. Katie, we'll get back to you once you get back in and are available again. So we'll go to Lisa Cordasco of CHLY Nanaimo. Lisa, are you speaking? Okay, we're going to move on again because of the time limits. Lisa, perhaps you can get out of the meeting and try again. Chantel Belrichard.
Hi, everyone, and thank you to Bill for that really great opening. I'm coming here I work with CBC Indigenous, and I'm here in Vancouver, so the Musqueam and Squamish and Tsleil-Waututh homelands. And my question is about, and this may be a bit early, was last week we heard about 2020 being the deadliest year for the opioid deaths that we experienced in British Columbia. And we've talked often about how there are these dual public health emergencies and wondering how much FNHA is aware of the impact that's had in more specific ways in First Nations communities and First Nations populations in BC.
Normally I'd ask Nell to answer this, but she's been away for a couple of weeks. We have just received the results from the coroner of the linkage to the First Nations client file and have not completed the analysis of that information, but we will be planning a separate opportunity for that information to be released. We won't be doing it today.
Okay, thank you.
Okay, I see. Do we have somebody else up here? Is Katie, are you back on?
Yes, I believe I've addressed the sound issues. Can you hear me?
Yes.
Yes, thank you so much for coming back to me. I'm just wondering, with the vaccine en route to more than dozen communities, how many doses does that represent? Like with the shortages, how many doses do you have in your capacity, and are you worried about the vaccination schedule given the shortage in some of the dosages?
Katie?
So we do have assurances from our provincial partners that the phase 2 priority of finishing all First Nations communities by the end of March is still possible. We've primarily used Moderna, so we'd have to be looking at using Pfizer, given some of the delays. But we still have a high degree of confidence that we'll be able to, alongside our partners, meet that target.
Okay, we'll try Lisa Cordasco of CHLY Nanaimo. Are you now available?
I'm hoping so. Can you hear me all right?
We do.
Oh, great. Thank you. Now, I'm assuming that there are the Indigenous population of British Columbia. The last census numbers I could get was about 200,000. I don't know if that's correct or not, but when do you expect to be able to have vaccinated the entire Indigenous population who wants to get a vaccine?
That's a bit of a challenging question. We have direct responsibility for the provision of vaccine to individuals who are resident on reserve. And we are working very hard with our regional health authority partners with regard to planning for vaccine implementation for Indigenous people living away from home. So that's a piece of work that is ongoing, and we're getting there. But at this point, it's still early on in that planning.
Well, can you give me a bit of a breakdown then? The vaccine that you have access to or are promised, what percentage of the population on reserve would be vaccinated, and what is the timeline there compared to what is the population who live off reserve?
So maybe I'll go to Katie to answer the first part of that question.
We need about 42,000 first doses to be able to ensure that vaccine is available to all individuals living in First Nations communities. I don't have the data myself related to the away from home or urban population, but we get that 42,000 is the number for communities.
So Shannon, any comments you'd like to add?
It has been challenging in that our target population on reserve are for those aged 18 and above, with a whole of community approach wherever we've been able to do that. Some of our regional health authority partners who have contributed vaccine have been contributing based on individuals aged 65 and above. So we will have to go back to community to complete the whole of community approach. My understanding and my work with the regional health authorities, which I said was ongoing, it's difficult for us to know for sure. We have the Indigenous population much more broadly than just First Nations, working with Métis Nation BC, the BC Association of Aboriginal Friendship Centers, and the regional health authorities to try to figure out exactly who those people are and where they are. But my assumption, and just doing a little mental math, is that we have about 150 Indigenous people living away from community, though not all of them, of course, are First Nations.
Yeah, and part of the what is anticipated is that the rollout and the more general mass vaccination interest, that these plans are being developed and finalized. So I would say this is a work in progress that we would expect we would have some clear understandings within the next month. But I would say that that's also dependent on that regional province-wide planning that I mentioned earlier.
Okay, with that done, let's take the next question from CTV Newsroom.
Oh, hi. It's Rob Buffum here with CTV News Vancouver Island. I don't know if that's, hopefully that's who you're hoping for the question. I'm just trying to get a sense of, and forgive me if I'm being repetitive here, but I'm trying to get a sense of how many First Nations people in the province have received a vaccine so far. And then I'm wondering if you can also address specifically Vancouver Island. I'm thinking of Cowichan tribes and Snuneymuxw in the Nanaimo area, specifically when you think all the folks in those communities will be vaccinated.
I'll go to Katie for the data in summary. One of the things that we do try to stay away from is actually referring to specific communities for a number of reasons. So I'll turn to Shannon and Becky for the second parts of that comment.
I just wondered if you could repeat the beginning of that question. I don't have the island specific information in my hand at the moment. If you could just say the beginning of it again, I can look for it. Sorry.
Okay. Yeah, no problem. I'm wondering if, and it may have already been mentioned, but I'm wondering how many First Nations people in BC have received a vaccine to date. And I guess if you're able to include when you expect all First Nations people in BC to have that vaccine.
So we vaccinated close to 16,000 people, and then the health authorities have also vaccinated another approximately 3,000 people at urban clinics. So in the downtown east side, in Fraser Health, for example, they've done clinics in urban centers like shelters. So I'd say it's close to 19,000 to the best of our calculation. I think one of your questions was about the island region in particular, and in our communities, we've been able to offer between ourselves and Island Health just over 4,000 vaccinations there. And in terms of when we can expect, based on the province's vaccination strategy, to complete dose ones in all First Nations communities, that's planned for being completed by the end of March, assuming pending vaccine availability.
So phase one is rural and remote isolated communities plus communities with clusters. So all of those would clearly be done as part of that phase one. Shannon?
Thanks, and I'm noticing on the chat that somebody's having trouble understanding who's speaking. So that was Katie Hughes. Sorry, I've lost the detailed question. Could you repeat it, please?
Oh, I wonder if, and I guess as I think most of what I'd asked was answered, but I'm wondering if maybe if I could just ask what challenges you anticipate there will be in making sure that everybody who wants a vaccine in those First Nations communities will get one. As we, the end of March was given as a goal by the province. What challenges do you think will exist there in getting that done?
Our biggest challenge has been the amount of vaccine. The province has been working with us to provide as much vaccine as is possible, understanding all of the pressures across the province. First Nations on reserve, especially in remote and isolated communities, was among the primary set of priorities. And it is our intention in working with our provincial partners to have all of the First Nations communities have the opportunity to receive vaccine if they choose to by the end of March. The urban population will likely take longer depending on accessibility. We're also working with our partners to make sure that vaccine will be offered in a safe and culturally appropriate manner.
Thank you.
So we're going to take the next question is from Denise Tishin, although it's not indicated, I believe, Denise, you're with the Shilsta, correct?
Hello, can you hear me? Hi, I'm
Yes.
Denise Tidian from Shilsta newspaper. Sorry, I must have somehow logged on with my husband's name earlier. I don't know how that happened. Anyway, thank you for taking my question. You've answered it. I wanted to know numbers about Vancouver Island on reserve vaccines. What percentage of the island Indigenous communities have been covered? And again, the challenges and that's the vaccine supply. So I don't know if anybody would like to add anything.
It's Dr.
Next, I'll turn to our panel, Shannon.
It's Dr. McDonald. One of the biggest challenges for us this week has been the weather. We lucked out in that the vaccine that we were delivering mostly got delivered on Friday before the weather changed. So those are always concerns for us. And the other piece of this is really about working with our partners where they have a bit of a different view, where they've had to spread their vaccine over many, many more people, so are more inclined with the 65 plus population, where we have been quite focused on everybody over the age of 18. But again, depending on vaccine availability, but we're getting there.
Okay, the next reporter, we're going to take a question from Sheila Scott at CTV News.
Hi guys, thanks. Can you hear me?
Mm-hmm.
Yes, we can.
Perfect, thanks. I just want to ask this question for my colleague, but Canada's National Advisory Committee on Immunization has put out some guidelines suggesting that those from racialized groups hit hard by COVID-19 should move up in the priority queue and go to priority 2. Looking big picture, is anyone able to weigh in on what you would like to see?
I'll start with Shannon, then I will, Dr. McDonald, that is, and then I will go to Dr. Palmer.
Thank you. And the NACI recommendations, of course, are handled differently across the country, and every region has the opportunity to accept or adapt NACI recommendations. The challenge has been, and I've heard this in many meetings that I've been to, that these prioritization lists get longer and longer and longer, and absolutely agree that there should be individuals who have significant vulnerabilities prioritized, but the list of people who believe they should be prioritized is much longer than the available vaccine. We have received significant support from NACI and from the federal government in that the prioritization of First Nations and Indigenous people, recognizing the increased vulnerabilities, have been prioritized in priority 1 and priority 2. So no problem with anybody else getting it if it's available, as we have a particular lens and we want to make sure that as long as the vaccine is available, the population we serve will receive vaccine that they need.
Thanks, Dr. McDonald, and I would echo your comments. It's Dr. Becky Palmer speaking, and just say that along with our partners, there's been strong advocacy and uptake of our first prioritized populations, and in working alongside our regional health authorities and our Ministry of Health, continuing to roll out the vaccine with that prioritization in mind, for sure. So, pleased with that approach. We'll continue on advocating for a whole of community approach, recognizing all the factors that go into place around ensuring that our entire community is seen as a priority as well. Thanks.
Thank you very much for your question, Sheila. We have one question showing remaining now from Cindy Harnett of Times Colonist. Before, Cindy, you speak, though, I just wanted to let you know that that is the last question. If you have, oh, we got another one from Chantel. If you, the reporters, have any other further questions, now would be the time to raise your hand. But we'll go to Cindy Harnett at Times Colonist.
Hi, thank you so much for taking my question. I just want to get at those Vancouver Island numbers another way, or just to clarify. So if about 4,000 people have been vaccinated, First Nations and Indigenous on Vancouver Island? What is the total population? And if 90 communities of 203 have been vaccinated, how many of those 90 are on the island? And we have 426 active cases, if I understood that right. Perhaps I could be wrong. If that's so, how many deaths have we had to date, please?
I can do the 426 active cases. Those are total active cases on reserve and off for the whole province. And those were numbers as of Friday. In or near community at 185 cases. We have had deaths reported over the weekend, but they're not on my data sheet yet. As of Friday, we had 68 deaths in total, 38 who were resident in community. And I can't speak to the entire population on the island. I'm not sure. Katie, would you have that?
Yeah, I'm just running the numbers at the moment, but what I can tell you is I don't have the population numbers necessarily, but I can tell you that we've finished vaccine campaigns, dose ones, in 16 communities on the island. We have another 5 that are partially completed, and then we just need to finish the balance of communities after that, which is about another 30.
Okay, thank you so much.
Thank you for your question, Cindy. Before I go to Chantel, just a reminder that anyone who wishes to get a response to a question in French, we have Sonia Isaac-Mann who is available to do so. Let's go to Chantel Belrichard.
Hi, thanks for letting me ask another question. I'm wondering how FNHA is working with communities and different First Nations on this distinguishing between on and off reserve for vaccine rollout, and what advice you're providing. I see a lot of communities announcing, that they're going to have vaccine, and people who still live on their territories but are technically not on reserve asking, can I come home? Can I come get the vaccine then? Do I have to wait for an urban clinic? And how is FNHA, what's the messaging on that to communities and community members asking these questions?
Let's start with Shannon, but one of the things we do as part of our process is we draft a letter to the leadership of the community, and essentially we relay all of our guidelines about vaccine usage, and essentially that is for the in-community residents. But I'll turn to our panel for additional information, and then to Katie, including Katie at the end. Dr. Mcdonald?
Thank you, Richard. This has been a really challenging question because culturally leaders are coming back to us and saying they have responsibility for all of their members, no matter where they live. Unfortunately, in the context of vaccine shortage, there have been extreme limitations as to how and where we can provide vaccine. So the numbers that have been given to us have been based on the 2019 census, and then were calculated with a 90% uptake, which is actually more than the uptake that has occurred in most of our communities in terms of individuals on reserve. But what we don't have is sufficient supply for all of those members who live away from home and would like to return. We have received requests for travel support for individuals from Vancouver, for example, who want to travel back to their home community in the north, and that's just not something that we can support at this time. It would be great if we had vaccine that got to community where there would be enough to be able to invite many of those individuals who do not live in community to be able to come in and receive their vaccine at that time. But as time goes on, there may be sufficient planning available. The work that we're doing with the health authorities about how we move forward for Indigenous focused vaccination off reserve, that there may be other opportunities to provide vaccine to those individuals closer to where they live, not necessarily in the city. So the work continues. It's still our commitment to vaccinate everybody that wants to be vaccinated by the end of this. And we're hoping, listening to our federal and provincial partners, that will all be accessible and available by the fall.
Thank you.
Thanks, Dr. McDonald, and it's Becky Palmer here. Just adding a little bit to that, Richard had shared with you around the letters that we send to community leaders, notifying them that the vaccine is coming and certain ways in which that will help support the conversations along with their communities. But to also let you know, a big piece of this has been a communication and engagement strategy to just really help support the messaging. So we've had a series of webinars across the province with community leaders, community members, our health directors, our chiefs, council members, as well as our clinicians to continue that open door, open it up for questions and providing the answers to that. So that steady stream of conversation and answering the questions that are surfacing. And I think that that's been really helpful as well. We've also developed a communication toolkit, so a way in which that'll help support our communities with the vaccine rollout. And again, that's all around clarifying communications and what roles would be and how to be ready in advance. And all of that also wraps around that conversation of, you know, who the vaccines are for at this current point in time. We also have resources that we send to our clinicians as well, so that we're really trying that wraparound approach that everyone involved in the vaccine rollout, albeit with our at-home population, has the messaging they need, so it's super clear who's eligible at the current time, and then always sending the messaging that if not now, we are always working with our partners to ensure that anyone who chooses to get a vaccine will be able to do so. Thanks.
I don't think I have anything to build on what they've said. Thank you.
I think the other variable is that at this point, it's not really desirable to have people go from sort of urban areas back to their home communities. So I think that's the other public health advice that we've relied on. The other rationale for starting with remote communities and working our way in is that those communities have less access to acute care. So that has been part of the approach as well. So this is really trying to mitigate the risk to people who might be exposed to COVID and the consequences of that. So those are the other pieces of that. So I would say that's our best available information at this point.
Thank you. We'll go to our next question from CBC reporter Susanna De Silva.
Thank you very much. This is on behalf of my French colleague who'd love to take you up on the offer of an answer in French, if you don't mind, to answer what is the biggest challenge facing First Nations communities in terms of the vaccine rollout.
This will be Sonia Isaacman will be responding to that.
Bonjour, merci. Je pense que les barrières plus difficiles pour la vaccination, pour la première nation, sont la disponibilité de le vaccin, puis aussi le transport environnement pour envoyer les vaccins dans les communautés, dans la Première Nation ici en BC.
Okay, we'll move from Susanna to CTV News reporter Sheila Scott.
Hi, thanks for taking another one for me. I'm just curious, you might be able to save me some math here, but with the supply issues that we had, how many doses under are you now than where you had expected to be at this point, just with how much things have ebbed and flowed and changed, obviously, since this plan was initially announced? And I do have a question after this too.
We're short about 22,000 doses at the moment to be able to complete first doses in all First Nations communities. Where we expected to be, well, we actually expected to not be receiving vaccine until the middle of February. And then at the end of December, had the opportunity to receive vaccine. So we took it and have been running ever since. So I think we're in a good place, and we are, as I mentioned, relying on the provincial strategy to ensure that all communities receive vaccine by the end of March.
Thank you. And can I ask one more quickly? I'm just curious, with the mass vaccination rollout happening kind of in March, and this program going to be expanding so much, I'm just curious what kind of feedback you've given to the province as they set that up, as far as what has worked and maybe more importantly, really what hasn't worked or has been really challenging.
I'll turn to Dr. McDonald, but then also to Dr. Palmer, as she's involved with that work in terms of our experiences. So Dr. McDonald.
Thank you. I think there's a couple of factors that have been part of our conversation with our partners so far and probably will continue to be, and those are the issues of access and safety. And when I'm speaking about access in urban communities, if the mass vaccination programs are being planned where there is good public transportation, where it's easy for people to get there, where it's easy to understand what's expected of people when they are received. And the other piece of that, and it leans to the cultural safety piece, is the fact that sometimes people walk in the door and they're not sure, or they have questions, or to be assured that people are giving fully informed consent, that there needs to be a moment of interaction before the vaccine is given. And some of the planning that I've heard talks about, so many minutes per vaccine, and that there will be 40 vaccinators in a large space working at once, where large numbers of people and noise and confusion may be occurring. And for some individuals, and I'm thinking specifically about our elders, that may be overwhelming. And they may not be inclined to attend in that kind of space and place. We want to make sure that people are understanding fully what's being given to them, and what the expectation may be around second dose, for example. So those conversations continue, and our big piece of our work is making sure that there are alternatives for people other than these mass vaccination centers to receive what they need. But those things aren't settled yet. And I know that the province's goal is to maximize the number of people that can be vaccinated, but we also want to make sure that the people that walk in the door are happy with what happened while they were in the doors before they go home.
Thanks, Shannon, and thank you for the question. It's a beautiful question, and I, really signaling that we are working in partnership with the Ministry of Health and our regional health authority partners around the planning of the max vaccine rollout, and we know that we hold a big part to play as partners in that work, and as influencers in that work. So I can share with you that, at the tables we're sitting at, we are having conversations around really capturing the learning we've had thus far and what our communities have been telling us and what our community members have been telling us with respect to what's working well, and the beautiful pieces of this that are the uptake in communities. So our elders who are receiving vaccines are sharing their story. The province right now is ensuring that we're telling our story with this, that to Shannon's earlier point, Dr. McDonald's, is that this isn't a transactional experience. It's not about the flow through exclusively. For us, it's a transformative experience. It's an opportunity to tell our story and write the story that is meaningful for our First Nations people, so that, where it makes where it's meaningful is that we have ceremony around it, that we're blessing the vaccine in advance, that those teachings that have been held so dear are really brought forward as we move through a vaccine rollout. And so we are sitting at tables with the province to share what we know, to share the learnings that we've had thus far, to build on the strengths from our communities and what they're telling us is important and meaningful for us. And really, this all has to be done in a way that is culturally safe. So folks aren't going to come through the door if they don't feel like it's a trusted, safe place to do so. So our conversation as the planning rolls out is to ensure that those considerations are all in place in advance, so that we're doing the engagement and communication in advance, and that as people come to the doors, those doors are there with open arms, that are a welcoming environment, and one that's going to honor the individual as that individual receives their vaccine. So again, just really signaling that this is a transformative opportunity, not a transactional one. And so I think that's the biggest seed we're planting here, is something different needs to emerge here, and it'll tell a different story, and one that First Nations can own themselves about their health and wellness journey. Thanks.
Thank you. We're going to take another question from Times columnist reporter Katie DeRosa.
Thank you. I was just wondering, with the shortage, do you have sort of a number of the current doses that you have to deliver?
We have some doses that are in communities currently where the clinics are in process, but we don't have any doses in the fridge or freezer needing to be deployed, if you will.
Thank you for that question, Katie. We're going to turn now to Karen Larson of CBC.
Oh, hi, thank you very much. I just want to confirm some details. You spoke about the end of March as being a goal for vaccine to be available to all the people in communities who want it. Are we talking, is that correct? Do I understand that properly?
Yes,
Okay, and those are first doses, is that correct?
that's correct.
Okay, thank you. And the other thing I just wanted to confirm, you said there was no confirmed cases of variant, but then you said there was no certainty that the variant is being tested for. Am I understanding that properly?
In some ways, you're asking the wrong people, because the testing for the variant happens away from First Nations Health Authority. All I can tell you is that we have not received notification of any positive case of the variant to this point.
Okay. Thanks for clearing that up. I appreciate that.
Okay, and this, we're now 4 minutes to the end of the hour, and we're going to take our last question here from Lisa Cordasco of CHLY in Nanaimo.
Thank you. I'm wondering if you have been able to make any conclusions about the efficacy of the vaccine that was given to the Shannon First Nation and the Cowichan tribes in preventing transmission.
We haven't done that as a formal study. There have continued to be cases in both of those communities. But as Richard said, we don't really speak to those details. But I have not yet seen any analysis that in both cases, the vaccine was provided through Vancouver Island Health Authority, and I don't know if they have done that work.
Any other comments, Dr. Palmer?
Okay, with that, we're going to wind up the Q&A session with the reporters. Just a reminder to everyone that I believe sometime today we will have a video of the media avail loaded up to our YouTube channel, so you can watch for that. And I will turn it now over to our CEO, Richard.
Yeah, I just want to thank everybody. This is an efficient mechanism for us to be able to give you the update, at least as it stands, and that we will provide these periodically as the circumstances change, but also with some regularity. So with that, just want to thanks and turn to Bill for a closing word or words.
Thank you, Richard. Of course, what I'd like to do is say thank you to everyone that's working to make things better, make things brighter. And quite often I sing this song in so doing. It's a song that has words in it that thank the chiefs for making a brighter world for his people. And of course, the First Nations Health Council represent our chiefs and they work with health authority to do that. So. Close to Thank you to all those that are working to make this world a brighter place for our people. I said before, this song was recorded in 1938, the very year I was born. So it's an old, old song. Thank you.